Okay. See if that goes. Haven't picked up my Instagram. Yeah, there we go. Okay. Well, thank you for joining me today. I've got a very special guest with us to talk about the really interesting connection between your teeth and breathing. And it's one you may have heard people talk about recently, but it's not a common one that that is conventionally talked about, how breathing affects your teeth. And so I'm really excited to talk about this. Dr. Dan Hanson, thank you for joining me today.
Good day, Stephen. Yeah, thanks for having me here. Really appreciate it. Thank you.
Yeah, your work has been, emanating in this space for some time, and we worked together, a number of years ago, in terms of educating professionals between, the links between food and breathing, and how it affects growth and development. But it's not such a widely known concept that breathing affects your dental development and dental health in general. I was wondering if you could lead the audience into understanding how you got into this space as a dentist to be thinking about breathing so deeply.
Yeah, okay. In a nutshell, it was my own health journey. So at age 30, I'm 45 now. Age 31, I had pretty bad sleep apnea. And at the time, I was a sleep dentist, or, that was part of my work. About 30% of what I was doing was helping people dentally bring their jaws forwards as adults with dental appliances to help them with sleep apnea and snoring. And I was getting pretty good results with most of my patients. But I tried treating myself and just didn't get anywhere. And my only option was a CPAP machine, which I was determined not to use. And I skeptically went along to a community hall evening with a Buteyko practitioner, where he gave like a free information session. And all of the science he presented seemed to stack up. I skeptically went and did a 4-day program with him, which is a classic Buteyko method program. And during my program, I was on the course with about 5 or 6 other people. And I saw one old guy who was quite overweight actually improve a lot with his sleep apnea in a very short time. I saw a young boy get off of asthma medication in a very short time. And I myself I was training for a half marathon at the time. I started noticing sports improvements. And very quickly, I was basically told that I'm not snoring anymore at night, and I wasn't waking up gasping for air. So I became a Buteyko practitioner, and that was how I got into the breathing side of it, basically.
It's a really interesting journey, isn't it? Because, most people don't know how impactful their breathing is. You mentioned a few different kind of examples there of how breathing really affects people. And the worst end of it is sleep apnea, isn't it? And, I think even the people with sleep apnea, though, and we know all of the negative effects around that, but we don't know that it's that daytime breathing that really does kind of, influence how we're breathing at night. And that seemed to maybe have been even a disconnect before you went to this Buteyko breathing course. And how do you think, so all the science behind Buteyko, right? Why do you think this has been somewhat disconnected? Why was this, not shown to you in your dental training? Because you were trained, to support the airway at night, and you were looking at this. Why do you think the actual applications of breathing is disconnected in that way?
So that's a huge question. I mean, just to go back a little bit, and then maybe if we can circle back to the final question, regarding sort of, you said that the worst of it is sleep apnea. And I know that you know this, but not to be pedantic, but just to sort of say, well, what is further down from stream from sleep apnea is again, as you know, academic performance issues, behavioral issues. If you're not getting good REM sleep at night, perhaps because of high cortisol, because of high stress, from nutrition or from motion or from mechanical injury, whatever. If the body is stressed out and you've got high cortisol, you're not going to get REM sleep because that inhibits REM. And REM sleep's important for short-term memory. And so you got these kids in school, especially, who are, they're like away with the furries. But actually the reality is they're not getting good quality sleep. And so, yeah, the worst of it is sleep apnea. And then what comes on from that is, apart from some other stuff that we'll talk about, probably dental shape of jaws and so on, you've got this issue with not just cardiovascular problems, which is what most people know about, and then potentially death as a result of that. you've got behavioral issues being misdiagnosed, therefore being mismedicated. And you've got a whole bunch of other things as well, just like the ability to regulate one's own emotional self if you're not sleeping well. So it's, there's a lot in there. And yeah, sleep apnea is just the start of a whole bunch of other problems. But to answer your question, to actually answer your question, why? So the Buteyko method, B-U-T-E-Y-K-O, that's how it's spelled. Everyone always says, how do you spell that? Professor Konstantin Buteyko was a Ukrainian professor working in Russia in the 50s. And he came across, he sort of noticed people with chronic health problems had breathing dysfunction, which can be anything from upper chest breathing at rest, open mouth posture, breathing through the mouth, increased respiratory rate, incorrect location of breathing, so not dominantly diaphragm during rest, and audible breathing at rest and during light exercise. So these are the sort of things that we pick up for breathing dysfunction. And he noticed, in particular, one of the things he was looking at was high blood pressure and cardiovascular problems. And he's walking around the hospital ward and he's seeing these people. And if you imagine what a healthy person looks like, Lao Tzu, the ancient Chinese philosopher, said the perfect man breathes as if he is not breathing. And so he looks like, just still. He's still at rest, both emotionally and also bodily, still at rest and able to be present and enjoy the world. But sick people, generally, they're quite often rounded shoulders, forwards head, mouth open, breathing through the mouth. They're breathing a bigger volume of air than what they should be breathing. And that's why they end up getting the problems, which maybe we'll touch on later. But Buteyko basically saw this, did a whole bunch of research into it, and opened up a clinic, I think it was in Russia from memory, and was getting people off of asthma medication, helping people with high blood pressure issues, all kinds of things he was doing. And then he sent a guy called Alexander Stalmatsky over to Australia in the 90s and said to him, go and spread this method to the West. And he sent him to Australia because he thought Australia would be more open than the likes of America, maybe less dogmatic. And of course, Stalmatsky shows up, this Russian guy, with this message around, do this breathing exercises and pull people off asthma meds. He took it straight to Sydney, where he met with medical people there, people in charge, and he was shut down. Stalmatsky then went and hired clinics, and particularly in Bondi and places like that. He'd have like 50 to 100 people in a room, and he was just there, like kind of guns blazing, training up other people to be practitioners at the same time and pulling people off of asthma meds and all kinds of stuff. And you can imagine the medical establishment didn't really like the way that looked. And, of course, people tend to get shut down if they're kind of going against the grain. Most change in medicine happens top down. So someone in a university has a great idea. They do research on it. The research proves a certain concept. That then gets passed down to the professors. They trial it. If they're happy with it, that then gets into hospitals. Then the consultants use it. And eventually it trickles down to sort of GP level. Whereas this was bottom up. You had all these public, like there was newspaper articles and documentaries done on at this time about all these people raving about it. And it would get to a certain level, like to a newspaper level or a documentary, and then it would be shut down. And good research was done with the minimal amount of funding that they could get. Some research in the Mater Hospital in Brisbane, for example. Don't quote me on the exact numbers, but it was something like with asthma, a 97% reduction in asthma medication use compared to the control group, which were just taking normal asthma meds and having physiotherapy. And a 46% reduction in the preventer, which is the steroid. But that was only after a short time of doing it. And of course, the conclusion was, this kind of looks promising, but it's a small trial and we need more research. But who's going to pay for that research if you're not going to sell medication? So that's actually a short answer. It was quite long, but it's a short answer of the actual reality of the situation,
It's right, and it's an unusual therapy in terms of conventional medical settings. Understanding how a person is breathing, getting them to breathe a certain way. So it's kind of outside the box in a way, isn't it? So it does sit in that kind of category that you're not really trained to do. I remember when I first was introduced to kind of, breathing techniques through more myofunctional kind of training. It was a very strange brain twist for me. It was unusual for me to think like this. I thought doesn't make sense to me as a practitioner. And I think that kind of, bend in thinking is where, most kind of, conventional clinicians might be. And so that they may be missing that there is a connection to dental development and so forth. You mentioned the presentation of potentially ADHD and, this connection to sleep and breathing. Do you want to just describe how you have seen these patients and, the parents' experience in how these childs are experiencing this problem?
Yeah, I mean, I'm by no means am I saying that, that ADHD or some form of things like that, don't exist or anything like that. But all I'm saying is what I've seen is there's quite a lot of children are just quite easily and quickly put on Ritalin or other medication to manage hyperactivity or not being able to tune in or concentrate and so on. And sometimes, of course, that helps even, because the medication is showing some kind of symptomatic improvement. But then you either rely on that medication permanently, or maybe eventually, medications all have side effects. So ideally, we stay away from that. But I guess what I've seen is I will do the training with these kids and with adults as well. But let's maybe stick with that kids for now. We'll do the training with them. We'll get them to be able to more easily breathe through their nose, keep their mouth closed, breathe more functionally. And then the parents start noticing that they're sleeping better. And then they start noticing that the behavior starts changing. And then quite often what happens is the way I've experienced it is the parents kind of self-manage the coming off of the medication quite a lot. And then they'll come back to me and they'll say, oh, we decided to, see what they were like without the medication. And it kind of seems like they don't need it. They seem like they're okay now, or they need less of it. And so this is what I've seen. And then I'll say, as a health professional, my job then is always to say, well, please go back to the person who prescribed that to you and, just sort of see what their take is on it. And then, of course, that's up to the patient to do that. But that's generally what I've seen. And just to be really clear, when I'm doing what I call true classic Buteyko method, I'm not doing that in my capacity as a dentist. I'm not at all using any dental item numbers or anything like that. Quite often, I'm in a completely different space. Like I do it from my home sometimes. I do it from various retreats and events, things like that. And it's like I'm taking my dentist hat off and I'm putting this other training that, it's like if I had a job as a fireman, I could go out and be a fireman on a different day from when I'm being a dentist, right? So what it looks like is the person will come to me for 4 consecutive days, basically, and I'll spend at least 2 hours with them each of those days. And they will need to go away for at least a month, but usually 3 months, practicing these exercises about 5 lots of 12 minutes every day. So it's not just like, here's an exercise and you're all fixed. It takes an awful lot of determination and discipline on the part of the, in fact, I don't call them patients, I call them clients when they're doing just the Buteyko method. And so, yeah, there's a lot of dedication required. It's not just like an overnight, everything's great,
Breathing's a very intricate process, isn't it? And we don't understand, how unconscious it is and how there's many kind of checks and balances that the body is doing. And we'll dive a little bit into that later. But for parents that may not be all that familiar with this technique and that they suspect that there might be a breathing issue with their child, what would you say are the signs that a child, or a family member has a breathing issue they can pick up?
The most common sign is just literally the lips aren't together at rest. And I know that you know that, of course, but that's the most common sign. Lips aren't together at rest. And many people will say, they'll say, but I can feel, even though my lips are open, I am breathing through my nose. What I'd like you to do, if you're listening to this and you have that thought process, is just imagine what a garden hose looks like. You've got the normal nozzle at the end of the garden hose, which is where the water normally will flow out of. But can you imagine if maybe, 10 centimeters further along that hose, there was actually a puncture in the hose? Can you imagine that liquid would come out of both holes? There would be a leakage happening. And so even if it's sort of mixed nose and mouth breathing, if the mouth is open, because we've got fluid, in this case a gas, you've got expired air or inspired air, it's being lost and being drawn in by both holes, basically. So open mouth posture at rest is the first one. If everyone listening to this, if you just put your hand on your chest and one hand on your belly and do a medium-sized breath through your nose and notice what hand moves more, and then do the same sort of sized breath through your mouth, most people will notice that the upper chest is moving more when mouth breathing is happening. So that's another sign that we'll see is upper chest breathing at rest. But we'll also say increased respiratory rate. Generally, children have a higher respiratory rate than adults, so be careful. But generally, adults is 8 to 10 breaths a minute is pretty functional. Some textbooks will say 12 breaths a minute, and then older textbooks will even say 6 to 8 breaths a minute. But basically, increased respiratory rate, noisy breathing at rest, and upper chest movement, mouth open. Yeah.
Which is a very common presentation. And, in the dental examination too, this presentation of open mouth is very, very common today. So it's obviously been, it's seen a lot, but the identification that it's a problem kind of does flow into, potentially sleep issues too as well. What would you say are the sleep presentations of a child that doesn't breathe well?
Yeah, I would put it into the category or an adult, but there are some specific things to children as well. So the first one again is mouth's open while asleep. Mouth should be closed while asleep. You'll hear noisy breathing while asleep. The breathing should actually reduce in volume and in intensity when you go asleep. The body should be more at rest than during the wakefulness. But quite often we don't see that. You'll also see periods of erratic breathing. So the pattern of breathing will sometimes be quite quick, and other times it'll be very slow, or even apnea, which is not breathing. So you'll hear gasping for air, snorting, snoring, and people ask, well, what is the cause of snoring? And it's like, well, basically, if air is moving faster than it should be, there's something called the Bernoulli principle, which is similar to the Venturi effect in fluid dynamics, where as air moves faster, it loses pressure. And Bernoulli is, if it moves faster through a tube, that tube has a tendency to want to collapse. But as a minimum, as the air moves faster, you get turbulence, basically. Changes in velocity, particularly rapid changes in velocity, will create turbulence. And so soft palate at the back of the mouth there and parts of the airway, that will vibrate more the quicker the air is moving through it. It'll also have a greater collapsibility as well, which can add to apnea. But that's snoring, basically. We should be breathing quietly, gently, easily, nice, consistent rhythm, nice and calm. And then also with children in particular, they can be bedwetting as well. That's another thing that they can get.
So the audible breathing that you're describing there is part of a functionality of the tube that we breathe through, which you said, we should be breathing through the nose, but this tube can also collapse if we breathe too quickly. And you mentioned a rate of breathing that we should be aiming for a lower rate of breathing, which, often, you observe a lot of kids and they'll be sitting there and the respiration rates are, just through the roof. And you mentioned the test of the hand on the chest and the stomach. Now, when you observe children do this, so I really encourage parents to do this, check your kid to do this. You will notice, tell them to breathe in the belly. And most kids, if they haven't been trained to before, they just cannot do it. And it's in complete, they've got no awareness of their breathing mechanisms. And it really needs to be taught to people, doesn't it? And so it's like this journey that you went through really needs to be taught to us from a young age, and it's why potentially people do have such positive effects from a Buteyko course or Buteyko training. But for yourself, I'd like you to describe how, because you're in this snoring and sleep apnea kind of borderline, weren't you? And so what was the feeling for you changing that? Like, so as you began to become more aware of this, like, how did you feel as a person, you know, waking up in the morning when you beat the apnea? Because it's not very well discussed that you can actually come off a CPAP machine or maybe do something besides a CPAP machine.
Yeah. Tell me to stop if I'm going too long on this, because there's quite a bit potentially to go into there. But basically, in a nutshell, so at the time I was also a lot of my work was adult TMJ problems, so jaw pain issues, and I had a lot of pain issues myself. And the pain went away when I did the jaw treatment, which I was trying to use to fix my sleep apnea. So the first thing that kind of got knocked off the list of my health problems was severe head and neck pain. But the sleep apnea was still there, which is why I then went to the Buteyko thing. Then what happened was, people were saying, well, you're no longer gasping or snoring in the middle of the night. So, that was like big tick there as well. At that point, because I was starting to sleep better, I started to get more clarity of mind. That's the easiest way of explaining it. I wasn't kind of like fuzzy head and sort of cloudy all of the time. And also at the time, I was experiencing some depression, which I think was as a result of the long-term pain and poor sleep that I'd had. All the other parts of my life looked great. Like there was no reason for me to be depressed, but my body wasn't functioning properly. And so what then happened was a little bit of that went away as my sleep started improving, and I had this clarity of mind. And then I became more open to other things. That's when I then went on my nutritional health journey and ended up at ACNEM, which is the Australasian College of Nutritional Environmental Medicine. And I started learning about the sort of things that you wrote about in your book, low inflammatory diets, and, the fact that certain proteins in gluten and dairy can be an issue, and all these other things. So I started to notice new things. When you said, how did you feel? First of all, I felt less depressed and more energized. But as a result of that, it's kind of like peeling layers of an onion away, like the way we do in self-inquiry work, but also same in body work. When the body all of a sudden drops its major symptom, you start to feel the next thing. And I felt a bloatedness in my stomach, which I wasn't aware of prior to that, because I was all focused on the pain and the no sleep. So I noticed this bloatedness in my stomach, and then I went onto a whole, pathway of like changing diet completely. Then that went away for the most part. And I realized then if I eat certain things, my bloating would come back. So then I could use my body like a barometer because it was clean. And when you put something in, when it's clean, you can feel it. And then as a result of that, this again, more things started happening. I started looking into like ego and self-inquiry work. And I went down this kind of hole. Then I guess some people might call it spiritual, but really I would just call it, I went down I was able then and more open to go down a pathway at looking at self. And I started to then feel more present in the world and was then able to enjoy the world more. And then my career and everything else just took off. And it started because I was really got myself out of pain and then started getting good sleep.
It's fascinating you share that story, because, I think a lot of people are really unaware as to how much their poor sleep and breathing is holding them back. And, and if we think about this from a child's perspective, how much development and how much, potential, is a child missing out on if they have these sleeping issues. So it's really fascinating and helpful, I think, for you to share your journey on that, because, there's a lot of people out there suffering these issues, and, having that kind of impetus to say, hey, there's a lot of benefits here if we work on this, because it's not easy either, would you say? And in terms of, there's a bit of a barrier as to, the benefits you get from breathing that I've observed. How would you say that for people that do have, a sleep breathing issue or, some kind of, maybe sleep apnea or something along those lines, the journey that they have to go on in order to start feeling those benefits? How difficult would you say that it is?
Well, it varies. I mean, this is where the mind comes in and the individual psyche. Some people have had a really difficult life, and it's very, very hard for them to not feel like a deer in headlights and overwhelmed when they're given too much to do. And that as a change maker in health as well. It's like, you know, when you're trying to change someone's diet or advise them to do so, you might have to give them one thing to do at a time, because they can be very overwhelmed. And so, you know, let's just say all things being equal, and this person's, you know, extremely dedicated and open and has the resources and means and mindset to be dedicated. You know, you can start to get changes quite quickly, like subtle changes. It starts out subtly. People will say, you know, when, for example, part of the Buteyko method, which isn't an essential part of it, but it's a part that kind of turbocharges the changes, is we'll use some taping over the lips, and, you know, at nighttime. And some people will say, wow, like the first time the tape stayed on, which often takes a week or two for it to stay on, I literally woke up clear and went for a run straight away. Or I didn't wake up with a dry mouth for the first time in 20 years. Or my partner said I wasn't snoring. And that, even though they're still sleeping badly, that just feels good because now they're not affecting their partner so badly. So it's a really hard one to answer. But often it's very, very subtle changes. And you gradually, and then eventually you kind of get this exponential thing where all of a sudden it's like things really all line up. And people start, like in my health journey, as soon as they start to get some improvements, it kind of becomes a little bit addictive. And that's when they then go, you know, who can I go and talk to help with my diet? And that's when I'll send them to a GP or a dietitian or who else, or, you know, or a Stephen Lin, you know, like, it's like, that's the kind of, you know, people start to then want more because they can see that it's starting to improve. And it's not all about the breathing. This is part of the problem with research. When people have tried to research Buteyko, they say, okay, we want to drop everything else that you do and just focus on the breathing exercises. Because in science, you have to isolate something for it to fit their model of how they show change. That's not the Buteyko method. The Buteyko method is different for every individual. I'll spend an hour with them and do a consultation and work out every aspect of what could be causing their breathing problem in the first place. And then I'm going to be asking them not just to work on the breathing issue, but also to work on these different causes. So some people might see someone and get counseled on their nutritional status. Some people might start taking up yoga or mindfulness because they've got a busy mind that also upregulates the breathing. Some might just make some changes in their life so they're not constantly on their phone or their emails. Like, so we're working at a nervous system, a vagal level, a nervous system level, trying to bring the parasympathetic nervous system in and reducing that sympathetic tone. And it's sort of like, it's not just the breathing exercises when we're doing it at the kind of level that I like to do it at. So how do you research that? Like, you can, but what you have to do is just take a whole bunch of cases and say how many people got better, and then you're going to get the argument, well, maybe it was the fact they took up yoga, maybe it was the fact that they started exercising. It's like, yeah, maybe. And so then you just have to go, well, really a good Buteyko practitioner is really on some degree just a overall health coach that just makes sure that the breathing is optimal.
You describe the difficulty and the complexity of it very well, because, you know, there are so many things that will affect a person's, you know, respiratory system. There's sleep patterns, their neurotransmitters at night, and, you know, all of that comes together to affect how they get, you know, the quality of their sleep and everything that flows on from that. And, you know, we've kind of dulled it down in the clinical sense. You know, a polysomnograph is probably the one tool that we would measure sleep clinically, but it really is a rudimental tool, isn't it? And the diagnosis of sleep apnea itself is just kind of, it's a very small part of a very big spectrum, even within that rudimental tool. Could you comment a little bit on that in terms of how, you know, we measure sleep and so forth in terms of breathing?
Yeah. I mean, again, unfortunately, the system that we're in requires that there is some kind of measurement, as you know, like an objective measurement. But, you know, Christian Gimeno, who came up with the apnea-hypopnea index, which is the main thing really that gets quoted from sleep studies. You know, basically, he said just before he died, he wished he'd never come up with that measurement. And he realized it was just one measurement. And actually, sleep and sleep quality and sleep fragmentation, which is when the sleep is affected, there's so much to it. And I know there's lots of people will say, oh, you know, you should get 7 or 8 hours of sleep a night and so on. But I would far sooner have 5 or 6 hours of really good sleep than have 9 hours of poor sleep. And just speak to someone who's got really bad sleep apnea and what they're like when they have 12 hours of poor sleep. They feel awful. So it's difficult. It's very, very difficult because this is the system that we're in, and doctors they're trying their best, and we're a little bit, let's just say, unsophisticated in how we're deciding whether people have got poor sleep, because actually you can have no apnea and have absolutely awful sleep. It's not just about sleep apnea when as far as the symptoms go,
Yeah, and that is you can sometimes reflect on the test a little bit. You can see that there's a lot going on, but then the patient will be reported as not having a sleep issue because they've missed this criteria. There's just a question here. I thought we'd just broach this. It's a little bit of a controversial one. She's asked us to talk. You mentioned the technique of mouth taping in Buteyko. What's your thoughts on mouth taping for kids?
Yeah, it's a great question. So I invented a product with mouth taping called Sleepy Strip. That's and I did that because there's various different types of taping, and the kind of tape that I was taught to use was just basic micropore or leucopore tape across the lips. And that can work really, really well, both in kids and adults. I created Sleepy Strip with holes in it. And these holes can be joined up to make quite a large hole so that we can make it so that it's much safer. If anyone has any concerns, for example, I've never had a concern about people particularly sort of, suffocating or anything like that, because that reflex is so strong as long as the child is old enough. And so I never advise taping under the age of 5. That's the first thing. And it's not just an age thing, it's more of a maturity and awareness thing. So the child or the adult needs to be able to, say, for example, have a bad dream in the middle of the night or feel not good about the fact the tape is on, and they need to be able to wake up, understand what's going on and where they're at, and remove the tape so that they can feel comfortable. And so I think maybe a child under the age of 5 is it's a bit kind of difficult to know whether they're going to be able to handle that and do that well. But the younger kids, for sure, we've got the holes in the tape anyway, and the hole can be made much bigger. That's generally people's concern. Another concern I have about those smaller pieces of tape actually is that if they happen to go in the mouth and then they inhale those smaller pieces of tape, because they can lose their stickiness, that's an issue. Whereas the Sleepy Strip takes its anchorage from the cheeks and from the chin. It's pretty much impossible to inhale that and for it to come off and be sucked into the mouth, So yeah, don't do it under age 5 generally, and make sure that the child is comfortable. Practice during the day, make sure they understand what's going on, make it fun. You can do all kinds interesting exercises with the tape on, and yeah, that's basically. I hope that answered the question. I assume it was in relation to safety.
Yeah, I think, and in general, as you say, you're probably alluding to kind of the help of a professional like a myofunctional therapist or Buteyko Breathing, or their health professional in terms of guidance on that too.
Sure. Thanks, Stephen. Just to add to that, yeah. So if you feel like the child's got an actual a problem, then really you should be seeing a health pro to help with that, for sure. I sort of felt that goes without saying, but it doesn't. So I appreciate you saying that. Yeah.
When parents are kind of turned on to this idea that their child is not breathing well, it kind of opens, like as you've described, this whole breathing space opens a whole door of kind of possibilities and awareness around the body. But then they realize, there's this mouth breathing has a whole host of other issues. The child's congested, or that also too their jaws seem to be affected. This whole moves into a space of a not so well-known space of dentistry called myofunctional therapy, and the applications of breathing and oral function and how it affects the development of teeth. Can you help us to understand how you moved into this world in terms of applying these breathing techniques to your dental practice?
Yeah. So basically, I want you to imagine that the teeth and jaws are like a big moldable lump of clay or plasticine. and the muscles that surround them, so the tongue, the lips, and the cheeks, they're like a sculptor. And in a child, these bones, the jaw bones and the teeth, that, as I say, they're moldable, and they're affected by whatever's happening with the function of the lips, tongue, and cheeks. And so when we mouth breathe, in particular, the tongue tends to sit, well, it sits down low in the mouth. It doesn't sit in the roof of the mouth. You can try and breathe through your mouth and put your tongue all the way into the roof of the mouth, and you won't be able to. It'll block your airway. So mouth breathing is low tongue posture. So if we then think about this sculptor and lump of clay analogy, when the tongue is low, we're more likely to get the top jaw being kind of more high palate and sort of V-shaped, because the tongue is not making its own imprint in the top jaw, and creating this nice U shape. And so and when the tongue is not functioning properly, and there can be a whole bunch of reasons for that, which we could go into if you want later, but when the tongue is not functioning properly, the other muscles will adapt and compensate, because it's essential for survival to be able to swallow so you can eat food. And so the cheeks will come in, and the lips will also come back, and they will contract when they shouldn't do, because the tongue is not going up into the roof of the mouth so easily. It's not starting in the roof of the mouth where it should do, which is linked with nose breathing. And so it's this adaptation or maladaptation that then creates this problem with the morphology or the form. And that's how it's linked. To answer your question, how I got into it was that I was doing early expansion orthodontics in children using techniques known as functional jaw orthopedics, which is like classic kind of expansion plates and things like that in the mixed dentition when kids are sort of between about age, generally between about age 6 and 10. And sometimes I would get these amazing results, and then they would come back to me 6 months later for a check, and they'd relapsed. And I'd be like, well, this is not good. Like, this person's paid all this money, and 6 months ago I thought I'd done a great job, and now I clearly I haven't. And so I started looking at why this was the case. And that's when I then came across Dr. Chris Farrell and a few other people as well. And he's the one who is behind the MyoBrace appliance, which is an appliance which helps to train the muscles. And he was part of the early development of the MyoMunchie as well. He was with that group of people. MyoMunchie all sort of started out with that group, and then he split off. And anyway, I came across him. He lived near me, and he had a clinic near me, and I ended up working for him. And that's how, by that point, I was already on this health journey of mine, understanding a lot about the breathing because I'd gone through it myself. And he also knew about the breathing and its effects on tongue posture. And then I started working with him, and then I started doing this with patients, and he was already onto that, really. He was already there was already some exercises that he was doing, which were taken from the Buteyko method originally. And things like how to clear the nose and a basic exercise that children do to help improving breathing. And that's how it sort of all kind of came together for me, really. Yeah.
And how would you describe it for people that are unaware of this whole space, the breathing and the tongue posture effects of the jaw? How would you describe to parents, what ages you treat at, and how to work with a professional to do this, and just a little bit into how you kind of work with patients with this?
Yeah. So we treat as early as possible. I also, not currently, but I'm in the process of resetting up and building a clinic to go back to doing my tongue tie work, which was a big part of my career a few years ago. So literally when I say tongue tie, it's the tongue is not able to move properly because it's tethered to the floor of the mouth. And in a case like that, literally we're working on potentially a 1 or 2 day old is possible, usually it'll be older than that, but that, as early as possible is basically the key to most things, because we're trying to use what's called neuroplasticity, which is the brain's ability to rewire itself. And so we consciously make these changes by giving them myofunctional therapy, which is exercises like going to the gym for the lips, tongue, and cheeks, for example, and breathing exercises. So we're consciously doing these exercises to change the wiring in the brain from the brain to that muscle, so that then the unconscious patterning becomes how it is when we're consciously doing the exercises. And that's the brain's ability to rewire itself. They say neurons that fire together wire together, meaning that it becomes a wiring, not just a short-term thing. So that's what we're aiming to do, and we do it as early as possible, because the younger they are, the more neuroplasticity there is. We're constantly making new wiring as an infant, and then as we get older, we do that less, and in fact, then we get some degeneration. Although we know that even in very old people, there is neuroplasticity still there, which is why old people should do Sudoku or crosswords and all kinds of other things to kind of keep those wires going. And so how we do it, the way it looks essentially is, the parent and the child come in for a consultation. We spend an hour with them. We take all their history and understand why they've got these problems. Often it's related to birth history, birth trauma, early use of bottles and pacifiers, tongue tie, not hardening the diet early on, soft, sloppy diets, which is the same thing, and then poor nutrition, which then creates inflammation, which blocks the nose, which creates low tongue posture. And so it's like we find out all of the causes and all the things we can potentially work on. And then we take records, we assess the case, and then we decide what we need to do. And then we present a treatment plan. And then in my case, I do it the MyoFocus way. MyoFocus is something that Dr. Donny Mandrara and I founded, probably feels like about 7 years ago now. And that's sort of our version of myofunctional orthodontics and so on. And we see the person for once a week for 8 weeks, where we're doing very intensive myofunctional therapy, giving them lots of exercises and breathing exercises if need be to do. After 8 weeks, and in that time, we're using something called a MyoMunchie as well, which is a little tool that helps the person to learn to swallow and improve their muscle function and chew. We'll be working with body workers, so it could be pediatric cranial type chiropractors or pediatric osteopaths generally. So we're always working interdisciplinary. And then after this 8-week period, they then graduate from this myofunctional therapy program. And then we're seeing them monthly, and then they're usually using something called a MyoBrace, which is a bit like a MyoMunchie, but it's a little bit different. And then when necessary, once they can keep this MyoBrace in at nighttime, which shows that there's been a functional change both in their breathing and in their muscles, and in their nervous system, most likely. Sometimes we then put them into an expander plate if we really need to grow the jaw a lot. That's a 3 to 4 month process generally, which is a BioBlock. We use a BioBlock. That's the John Mew appliance. Lots of people have probably heard of mewing. Well, John Mew is the father of Mike Mew, who kind of came up with that mewing idea, which is myofunctional therapy. And then they go back into a MyoBrace, and generally we see them for about 12 to 18 months, once a month, until the dentition and the teeth and the jaws are as they're supposed to be. And then we monitor them 6 monthly while the rest of the teeth come through. So that's a long answer, but the very, very distilled version of that is we want them to come in as early as the child is going to be compliant with what we're going to ask. And sometimes, for example, if you've got a 2-year-old who's sucking their thumb, it's occasionally, not always, it's not always easy. Sometimes it's as easy as, here's your MyoMunchie, and it's your new dummy. It's like, here's your big boys or big girls dummy, and it's a swap. They put this in their mouth, and instead of creating dysfunction, it's creating function. And in a 2-year-old, we can often correct the problem much quicker and very easily. And then other kids, they're not going to be mature or ready enough to do anything until they're age 5 or 6 or even older sometimes. And then we're working on them at that age instead.
This kind of therapy you've alluded to a number of times, it is a lot of hard work, and children especially can be difficult to get to kind of conceive that they have to, why they're doing this, but then also to the persistence to do so. So it's interesting you say that, the parent really kind of has to assess if the child is ready. That's been our experience, is that you really need to have the individual kind of buy-in of both the patient, the child in many cases, and the parent as well, in order for this to work. It's a whole relationship between everyone there, where we're all understanding that, why this is important, and it goes great. But it's, as you say, in some kids, you have to kind of wait and assess, don't you? Because they're just not ready, because you've really kind of shown that breathing it's a bit of a self journey, and even in children, they have to kind of be ready for that. So it's interesting that, that kind of theme runs through this whole topic, that, there has to be this this self-inquiry ready in order for this to really work. Would you say that's right?
Totally. Compliance is the Achilles heel of this treatment. The thing is, I noticed that when I was working from a normal general dental practice back in, must have been about 2009 when I first started doing this stuff, my compliance levels were really poor. And that was mostly because of the setting I was providing it in a dental surgery, on a dental chair, and all this like dental equipment around. The child's not in receptive land right there. Often they're quite fearful, in fact. And so, quite quickly, and particularly when I started working with, Dr. Farrell at the Myrobrace Clinic, I could see how he'd set that up to make compliance better. And that was something that he was very, very good at. He's done an awful lot of good in the world by the message that he created there. But from that, with this MyoFocus thing that I set up with Dr. Donny, we really, really go deep into, you mentioned the word self-inquiry. We go really deep into, when we're training practitioners how to do this, we go very, very deep into things like looking at one's own ego, looking at conflict resolution, and looking at human behavior and positive psychology. And so, we're not just creating a space where the child and parent feel good about this. What we're doing is we're training the practitioners so that they know themselves enough so that they can be in conflict, where the parent comes in and says something like, oh, it's been terrible this month. This treatment's not working because little Johnny won't wear the appliance. And the parent, even though they're not expressing it, quite often they're feeling like bad parents, or they're not doing it right. Little Johnny's feeling pretty bad about things because he's not getting his gold stars anymore, all this kind of thing. And it's how as another human being do I sit opposite someone, hear their problem, reflect that back to them, and actually kind of have compassion for them, and sort of go, hey, look, I really hear that you're struggling with this at the moment, and that's okay. Are you open to to talking a little bit about how we might be able to help you with that? Oh yeah, of course. And it's like, okay, tell me about your day. When do you get home from school? When does dinner happen? Who makes the dinner? And then it's sort of like, do you have a smartphone? Does it have an alarm on it? Can you set an alarm at 4:30 when you get back from school? So if you haven't done it yet, maybe it's a reminder. But also, how can I be in that space with another human being who's feeling pretty bad about themselves, and then somehow manage to reframe that and then help them to kind of feel good about themselves, so they can then go home with a positive mindset and actually move on. And that's it. Outside of my dental work, I run men's groups and self-inquiry events and rites of passage programs and all kinds of things like that, where really I'm facilitating a space where people are being felt, seen, and heard, and then we can really help them to move on.
It's a really interesting theme that's run through. It's like this both the self-inquiry, but also the time and the inclination to go through the intricacies of health and really understand what's going on. What would you've trained a lot of dental professionals in this kind of thinking, in your system, MyoFocus, but also in myofunctional therapy and so forth. What would you say is the kind of big steps that that most health professionals have to go through in order to be able to kind of start implementing this into their practice? What are the big kind of changes that you notice? Yep.
Yeah. Well, look, firstly, I don't think it's for everyone. And I think that's okay. I think that needs to be acknowledged. We need practices out there that are purely doing general dentistry, taking teeth out and meeting that need. When I say taking teeth out, I mean if they need to be taken out because they're decayed or infected or something. I don't mean for orthodontics. That's another question. But, we need those people there. And so I think the bare minimum is that my goal with all of this is to create these ripple effects around the world, where at least every general dental practitioner knows that they need to spot these problems and refer them on to someone who is equipped to deal with them. That's the first thing. So everybody really, in my view, if they're going to be a conscientious health professional, they need to at least know all of this stuff so that they can refer it on. But could you just, what was the question specifically again? Sorry, I just got sidetracked a little bit.
No, it's good. It's just, I was just trying to think of how what's the main changes in the health professional that you see in order to kind of practice this kind of way? Because you've mentioned a lot of time and a lot of kind of consideration for patients. Well, what do you think that switch is when you when you train a practitioner in these methods?
Yeah, they basically they need to quite often restructure their business a little bit. So, for example, I started out with every Wednesday afternoon from 3 p.m. onwards after school. That was the whole clinic turned into Myofunctional Orthodontics clinic for those few hours, and then quite quickly that filled up. And then we do the same on a Thursday, then a Friday, and before long, if you're not careful and you don't want to do that, you end up with a practice that's only doing this treatment. So professionals do need to decide how much of this do they want to do, and then actually structure the practice so it can work. Because doing it amongst all kinds of other treatments doesn't really tend to work so well in my experience. So that's one thing. The other thing is it's important that the practitioner is willing and able to kind of become a bit more of a health coach rather than a doer. Many times dentists, we like to fix things. And if there's decay, we drill it out and we patch it up. Whereas this is very different. You're actually more like a coach or a personal trainer in some senses. Quite often you're not doing what looks like dentistry other than the diagnosis and treatment planning side of it. So I'm not sure if that answers the question for you, but there's a change in mindset required and also a decision to kind of like, how much of this do you want to do,
No, it does, because it kind of alludes to, that most healthcare businesses aren't set up very well to enact this treatment. And it's a consideration for a health professional. So you really have to think about, okay, so if you want to kind of consider these things for your patient, how is your business set up in order to do that? And that's a big process, right? And so for a healthcare professional, wanting to do this change or wanting to enact this kind of treatment, they have to go through a lot of things, in terms of considerations for how their team, how their systems of everything are going to do, how they communicate with their community. So I think that's a really good point. It's like one of the really important things is that the healthcare professional has to think about how they're going to apply this to their patients, which is, and that maybe that our current systems aren't quite equipped that way.
Yeah, exactly. And when I first started doing it in a basic dental practice, I was the owner of the practice and my associates working in the room next door. And prior to that, we're both kind of doing quite evenly for the business, both kind of bringing in, enough revenue to make the business work. And I became super passionate about this stuff. And all of a sudden, my business partner, who wasn't working in the practice, he was outside the practice, he said to me, this practice is going to fail if you keep doing more and more of this work, because you're not actually, to the patients, it feels like a lot of money, but as a dentist on an hourly rate, unless the practice is set up to make it really work well, it's about a third to a quarter of what you can be earning if you're doing, implants and bridges and all kinds of other treatments, cosmetic treatments. So, it's an important decision, because the funny thing about doing things like this is it's got to be sustainable. You got to be able to actually keep providing the service. Otherwise it's just a flash in the pan,
No, that's right. And, with new systems, this is why things like item numbers and so forth are made, because, it creates sustainability and creates repeatability for people to access services. So it's a big thing to think about. And I think it kind of goes back to the original point as to, why isn't breathing addressed by dentists. I think that's the point, is that it's hard to apply this into dental practice. So I think your experiences has really kind of helped paint that out. Dan, I know you've got to run to patients now, so we've got so many more questions here. But before you run, would you like to let us know what you're up to today and how people can find you?
Yeah, thanks, Stephen. Well, currently, right now, I'm sitting in the consult room at a clinic called the Health Lodge, which is an integrative medical practice in Byron Bay, New South Wales. And I'm here 2 days a week doing the myofunctional orthodontics that we sort of mentioned about before, and myofunctional therapy. And then very shortly, I'll be back at my old practice in Burleigh Heads in Queensland for a couple of days a week doing my tongue tie surgery work, which is great. We're just sort of rebuilding that, resetting that up. I travel overseas about 3 times a year, teaching dentists, orthodontists, and other health professionals about what we do. I'm off to Malaysia in a couple of weeks for doing a 4-day lecture there with my amazing partner, Donnie. That's the MyoFocus thing. And I run rites of passage programs for fathers and sons as they're becoming teenage boys, completely different thing. And I run men's self-inquiry and other events. So you can find the Byron Bay stuff at, you can look up the Health Lodge, or you can look up the myofunctionalspace.com.au, which is the clinic within the Health Lodge. And then from that, the Myofunctional Space, you can also find what we're doing in Burley when that's happening for the tongue tie stuff. And if you go to ritesofpassageinstitute.org, you'll find something that's all completely different from what we've been talking about. That's an incredible organization that I work for, running these rites of passage programs. And you can also find Breathe. You can go to the Breathe Health Retreats website, and that's where I run my men's programs and self-inquiry stuff there as well. So I'm up to all kinds of things. It sounds like I'm likely to be overwhelmed and super stressed and busy, but I've got a really beautiful balance in my life, thankfully. I've worked a long time to make that happen. And that's another thing that I really try and promote with the patients is, where possible, be really careful with time management, especially when trying to do all this stuff we're asking them to do,
Dan, thank you so much for sharing your journey. It's such important work, and this hopefully this kind of consideration really kind of emanates far through our profession, and I think it will because of your work. So I look forward to further conversations like this, and hope you have a great day.
Thanks, Stephen. Appreciate it, mate. Have a good one.